On the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris coming to you on a Monday. I hope you had a good weekend. I hope you wore a sweater this morning when you headed out, because it is cold now all of a sudden. Here we are already, winter temperatures. So stay inside, join in the conversation this morning. We'll get the number up on the screen here in just a moment. This morning, we're talking malpractice. We'll get into the details with you. If you have any questions about a case maybe that went sideways with you involving a doctor, a hospital, a surgery, you have questions about it, really, it's amazing. We've been doing this program for quite some time, talking malpractice, and how many different cases I hear of and how many people dealing with this. Well, this is your chance to get some good legal advice this morning. Find out whether or not you have a case, and if nothing more, just to listen in, because our guest is fascinating what he deals with on a daily basis. With us this morning, malpractice attorney here in town, one of the very best, Clint Kelly.
Good morning, Nick.
Good morning to you, sir.
How are you doing?
Good. It's good to have you on.
Yeah.
You know, it is true. You've been coming on for several shows over the years now, and it's, to me, it never ceases to amaze me how many people call in with problems, or how many cases you tell me. And I keep thinking you're supposed to go to the hospital or a doctor to get better.
Yeah, supposed to.
And most of the time that hopefully works out. The number 737-7587. As always, just at the beginning, I want to have him throw out there the basics of what constitutes a malpractice case and what you really need to know in terms of statute of limitations. Let's just do that.
Typical case, a meritorious case, is one where there's been a major medical mistake that's caused a major injury.
Yep.
And you've got 1 year from the date you discover that injury to file your claim.
That does not mean, however, a bad result from some type of medical procedure. Doctors, aren't miracle workers. It has to be that they didn't do something up to what you like. You've taught me. I've learned all this from you. Standard of care.
Did not comply with the standard of care. I mean, I tried a jury trial last week. What was basically a bad outcome. The difficulty we had in that case was we never could prove definitively what the doctor had done wrong to cause the bad outcome. I mean, he said he did everything he was supposed to, and he basically had all the evidence to himself. And so we were trying to figure out a way to prove what he had done wrong, and came up short. And so the public understands what you're saying, which is if you have a bad outcome and it's the product of negligence, you've got a good case.
Mm-hmm. You have to prove that.
Correct. But if you have a bad outcome and the doctor did what the doctor was supposed to, complying reasonably with the standard of care, you have no case.
I got to ask you about that case just a bit. I mean, you don't always have, you take on cases.
Sure.
You're selective in the cases. And
Yes.
this one, and you say some cases you have, it's 90-10. You've got the evidence, you know you're going to do well. Sometimes this one sounds like it's more of a 50-50 case, right?
It was.
And so, your client wanted to roll the dice and go, and you took, the case on?
That's right. And what made this case probably more difficult than other cases was the fact, as I said, that she clearly was injured, and I thought she had a fairly significant injury, one that meets our criteria for going forward. But we just had difficulty determining for ourselves, and ultimately at trial, what this doctor had done wrong. And sometimes you take a case that's a little closer than you want to. Mm-hmm. This was one of them. And if I'm not taking these types of cases, nobody will.
Right.
So occasionally I'll take a flyer, if you will, on a case like this, and you come up short, but you do everything you can. And
the important thing is when Clint takes on a case, do you ask often for a retainer, or are you paid usually just on contingency?
Always on contingency.
Always
Never
on
ask for a retainer.
Okay,
Yeah.
So you understand the difference of that. You go to sue. You don't have to pay him anything up front. He gets paid if you get paid if you win. And that's why you have to be selective. You've said you've had cases come through the door where, yes, there's a clear case of someone who was wronged here, but financially, it doesn't merit taking it to trial.
Right, or there's a bad outcome like what we talked about, and I don't believe that I can prove that it's the product of negligence, and I simply have to tell the client, I'm sorry, I can't get you legal relief.
All right, to give you some ideas of cases, we're not just talking, doctors, surgeons, things like this, dentists as well. We'll take your calls, but we have actually someone who contacted us here at the station knowing you were going to come on, and they're probably watching this morning. If not, they may follow up on it anyway. He's an individual 5 years ago. He sent us x-rays. We showed them to you before the show, and we can't throw them up yet right now for you here, but he said that he had a surgery, I guess his wisdom teeth?
That's right, wisdom teeth extraction.
And what did you see in the x-ray? Showed a...
It looked like a piece of an instrument
left in his mouth.
Left in his mouth. That's what it looked like just from the x-ray that we saw, which clearly should be removed. And from what you're telling me, he had problems for
5 years.
5 years trying to figure out what it is, and there you go. Someone takes an x-ray of it and It's pretty obvious that's what was causing his problem.
So people are going to say, well, Clint, what about statute of limitations here?
His case falls into an exception, and one of the exceptions to the statute of limitations is if a foreign object is left in the patient's body, there is no statute of limitations or repose up until the time the patient discovers it. So,
Yeah, because you don't know.
That's right. You don't know. So, I mean, he could be in there for 20 years and it doesn't matter. Once you discover it, then the clock starts ticking. You got a year from that point. But up until that point, you've got the clock doesn't run because you don't know what's in there.
All right. So a case like that, X-rays always help. You know, what's the most important evidence oftentimes in these cases? Is it X-rays, things like this? Is it your expert testimony? If you bring someone in who's a doctor who can say, or a dentist, this clearly was not the standard of care. You don't leave instruments in someone's mouth. What's the most important part in a case?
I think the X-rays are the smoking gun.
Okay.
X-rays don't lie, Nick.
Right.
And when you see what's on there, it's pretty obvious that something's not supposed to be. That there's something that's not supposed to be in there. A doctor will probably look at that and say that's negligence. You don't leave an instrument or part of an instrument in the patient's mouth.
Okay. Let me ask you, what do you got here? This is one of these cases leaves you shaking your head.
Yeah, I read this over the weekend, Nick, and I was just stunned. And apparently these types of things are still happening. People, you know, have a bad view of medical negligence lawsuits and think, gee, we ought to cap cases. Poor doctors are getting it left and right. Here's a case out of Las Vegas where a woman went in to give birth, which should be one of the happiest moments of any woman's life, and she's on the table preparing to give birth, and one of the first things she hears is when the obstetrician left the bar the previous night and starts talking about tequila. And one of the staff that was assisting the procedure smelled alcohol. Oh, I'm not kidding at all. I mean, they've got this on video. They've got a transcript of this doctor being asked how many people were in the bar when he left. The nurse asking, "Did you waste a drink?" The doctor came in his Bermuda shorts. They've got all this is on video. The mother is complaining that the epidural is wearing off, and the doctor replies to her, "Oh, shoot. Scoot your fat ass down." That's in quotes.
But is this guy just wanting to throw his career away? Is this it? I mean, he flew off the deep end. I mean, this is crazy.
This is, unfortunately, and you see this from time to time, this is someone in the throes of alcoholism, clearly, and it's gotten completely out of control to the point where he does not have judgment anymore.
Yeah.
That's obvious.
Yeah.
And you know, if you don't have this on video, this is all hard to believe. I mean, the nurses are talking about the happy hour that he left the previous day.
Okay, let me ask you this real quick about video. I mean, are there surveillance cameras in delivery room? What are we talking about here? Video.
This is what the story says, that no one believed this happened until they got the video, and all of this is on video at the hospital.
So sometimes, to your knowledge, have you encountered this? I mean, I know that hospitals now rarely, and when my son was born 16 years ago, I was able to go in during the C-section with the video camera. Now, I didn't shoot the C-section, but I mean, I was there with my wife. I got some video. When the baby came out, I got some video and all that. My understanding is most hospitals don't allow that anymore for the simple reason that I'm in there catching it if something goes wrong, and that's going to be used against them. That's what I think.
I don't know if this was that type of situation, but...
Are there cameras, though, sometimes? Have you encountered that with video in cases?
I've never seen a video separate from what someone would bring into the room. But this apparently is on video. Apparently all of this has been captured. They had tried to interview the doctor. He hung up on the reporter. But it's a situation, unfortunately, that happens from time to time. And you know, with these situations, what will happen often is the doctor will be whisked away and shipped off to rehab very quietly. He may come back 6 months or a year down the road after rehab, and then they will begin to test him on a daily basis to make sure that he's not impaired when he comes in the hospital. But this is about as bad as I've ever seen it. I had one case before years ago where a doctor operated on my patient, and he was likely drunk. So this stuff still happens, and you know, until there are better protections in the hospital, it's going to continue to happen.
What are you going to do, blow a breathalyzer before you go into the OR?
Well, that's what they do when they come back from rehab.
Oh, okay. Well, that makes sense. If you have
to.
But to catch it the first time, how do you do that? Right. And by the way, the infant in this case was damaged, apparently.
What's being missed here, Nick, the nurses were in on it. This isn't some doctor who just showed up one day drunk and everybody's sitting there going, "Oh, we got to get him out of there." The nurses are having this discussion with him about where did he go.
Instead of one of them stepping up and saying, "Doctor,
Get
stop."
out of here, doctor. Go get somebody else.
So what does that say about the culture sometimes in hospitals with the hierarchy of a doctor and the nurses perhaps not being willing to step up and confront someone like that?
It tells me that it's out of control. This is a hospital. It's in Las Vegas, okay? It's not here, but this is a hospital that should be punished.
Yeah.
I mean, you've got to punish them hard.
Send a
to
message.
change it, exactly, to change that culture. This child was unfortunately born with what's called Erb's palsy, which is a paralysis to the arm due to nerve damage, and
From a rough delivery.
Yes.
Holy cow. Holy cow. I mean, in cases like that, though, you've said it in the past, nurses sometimes are your greatest ally. You've had cases where maybe they're the ones who step up and after
The one I told you about that I had earlier where there was a
Mm-hmm.
drunk surgeon, it was revealed to me through a nurse that was the reason why my client had been injured.
Yeah, no, she did the right thing.
Right.
These nurses didn't. All right, on that note, we'll take a break. We've got several calls coming in for you. Got some other cases I want to review with you, but the number 737-7587. Clint Kelly, malpractice attorneys here. If you're on hold, stay there. Carolyn and others will get to your phone calls, questions, and comments for him right after this.